Okay, thanks. My name is Michael Davis. Thank you, Dr. Coburn. I'm the Division Chief of Urology at UNM, and I know most of you in the room. And today, well, first I'd like to thank the Baylor Department of Urology for having us, as always. It's quite nice to have an academic urology conference in the state of New Mexico, and this is the only one that happens, so thanks for that. Anyway, today, this is not a hardcore urology talk, so I'd like to apologize up front. It's basically about the industry of healthcare and information technology. So if you look at information technology, it's now integrated into the healthcare industry. As the industry evolves, it's obviously going to play a larger and larger role in healthcare, including in efficiency, quality-based care, cost, and evidence-based outcomes. And our industry's been very slow to adopt new trends in information technology. Also one of the interesting things is large healthcare company or large non-healthcare companies are getting into the business of healthcare. So what I'd like to talk about today is just the history of information technology in healthcare, blockchain technology, and if this could be adopted, generative AI, which we've all heard about this year, and emerging trends in healthcare and the entrance of large non-healthcare based corporations into healthcare. That'll be at the end. So if you look at the history of information technology in healthcare, the Institute of Medicine came out a report back in 1991 when the internet was coming up. Basically, the title of the paper was A Computer-Based Patient Record, an Essential Technology for Healthcare. And what this paper called for is a computer-based medical record by 2001. And this is because the record would, support users with accurate data, alerts, reminders, et cetera, everything we have today. And in the 1990s, you had vendors developing this, including electronic health records, and healthcare organizations were implementing it, but it was expensive and obviously took a lot of technical support. So by the end of the decade, only about 10% of hospitals and 15% of physicians had implemented information technology. In 1996, we saw HIPAA, and HIPAA brought attention to the issues surrounding the use of personal health information, but also that the internet, which once again was really coming up, created new risks to patient privacy and security. So the decade really of health information technology where it really started to take off was from 2000 to 2010. You saw the Second Institute of Medicine report. You saw the Medicare Modernization Act. Pay for performance came in, trying to get rid of fee-based care. President Bush created the Office of the National Coordinator for Health Information, and you had the HITECH Act in 2009, which was part of the American Recovery and Reinvestment Act, but it also was meant to support adoption of electronic health records and health information exchange. And one of the sentinel reports that really propelled this into becoming more important was the Institute of Medicine report in 2000 called To Err is Human, Building a Safer Healthcare System. And basically the estimate of this report was that about 44 to 98,000 patients die each year because of medical errors. And some of these errors were as simple as poor transcription of a medication order. A subsequent report in 2004 by the Institute of Medicine also brought to light patient safety issues and called for healthcare organizations to adopt information technology to make it safer for patients. And the airline industry was seen as an example because of the seamless communication of information. And then from 2010 on, CMS incentivized electronic health records, as we all know. And so you saw establishment of Medicare and Medicaid EHR incentive programs. And by 2015, you saw more than about 500,000 care providers receiving over $31 billion in incentive payments to adopt electronic health records. The Affordable Care Act was introduced in 2010, and the mission of this was to achieve the triple aims for U.S. healthcare: improving the experience of care, improving the health of the population, and reducing per capita costs of healthcare. And so the Affordable Care Act really was something that helped propel information technology as well. CMS at this time was aggressively pursuing value-based payment methods to reduce costs, increase quality, decrease fee-for-service. But in order to do this, you really have to study population health, and the sheer volume and complexity of the data that you're studying requires health information technology to manage. And so if you look at some of the alternate payment models that were being developed, like accountable care and patient-centered medical homes, obviously health information technology has to be integrated into these payment models because of the complexity of data. One of the big issues, though, that we still have today in 2023 is interoperability. So the Office of the National Coordinator defines interoperability as the ability of a system to exchange electronic health information with and use electronic health information from other systems without any type of special effort on the part of the user. And so true interoperability encompasses any electronic source with information needed to provide the best possible health care. So the ONC published a paper in 2015 called Connecting Health and Care for the Nation, a Shared Interoperability Roadmap, which called for national interoperability by 2024. And I can tell you here in New Mexico, that's still a long ways off. What are the issues with interoperability? Really, it's the fact that it's a jigsaw puzzle with multiple public and private organizations working on different pieces, and there's really misalignment of incentives because you have different companies coming out with different EHR systems. Obviously, their purpose is to make a margin. They're not really concerned about interoperability. So I'm going to move on now to blockchain, which is a newer technology that we've seen come up since 2010, and this is something that could be implemented in healthcare, kind of segueing from interoperability into technology that could be used. So what is blockchain? It was developed for digital finance. How can the healthcare industry adopt this technology, and what are the barriers of this technology into the industry of healthcare? Blockchain is a digitized, decentralized public ledger. That's all it is. It was introduced with Bitcoin by Satoshi Nakamoto. And no one knows who this guy is, if he even exists. It may just be a pen name like William Shakespeare. But the problem was double spending in the digital age. You could spend at one place on the internet and then re-spend a token at another place. And so blockchain was really introduced to stop this practice. And it's really what they did was they developed a peer-to-peer public ledger without central authority. So how does it work? It's just interconnected data packages or blocks, and the blocks are transactional units of information about the sender, receiver, and the transfer amount in the case of digital currency. And really, the way this works is you take information and you compress it into a hash, and all a hash is a random combination of letters and numbers. An algorithm does this. And hash values are unique and very immune to fraudulent attacks because they're just basically random letters and numbers. So this is just showing an example. You take data, you use an algorithm, convert it to a hash, and then there's your unique hash value. So the first block, the Genesis block, is converted into a hash value, and then a second block is added to this block. So you have a unique hash value of the first and second, and this goes on in perpetuity. The mechanism is repeated, and this ensures integrity of the entire chain by linking all the information back to its Genesis block. And so here's how blockchain works. Basically, you just have these, in perpetuity, these blocks being created from the Genesis block. The other unique thing about blockchain, it's a peer-to-peer public network. So this is used to disseminate system information while keeping the system as decentralized as possible. So every peer or node within the network contains a copy of the entire chain. So basically, if it's a ledger, everybody's got a copy of the entire ledger. And before new information can be added to the chain, the community of peers comes together, agrees on the data validity, and then using a consensus mechanism, it's added to the chain. So once a block has been added to the ledger, it can no longer be changed or modified. And it's one of the strongest technological platforms ever invented. Obviously, it's used for currency, and so this makes it a pretty strong, secure platform. If you look at security, it's virtually impossible to alter the data in blockchain. You'd literally have to take somebody, tamper with every single block. That means they'd have to go backwards, find the algorithms, and work backwards. And then they'd also have to take control, because it's a peer-to-peer mechanism, of at least 51% of the whole network. So getting back to electronic health records, if you look at electronic health records today, they still face an array of challenges concerning data privacy and security, interoperability, and quality. So this would really be an ideal platform for a national healthcare record, for example, also for revenue cycle management and system interoperability. The strengths of blockchain include security. Hospitals are very easy targets for ransomware attacks. Ransomware is just a type of malware that's loaded, and basically you have to pay a sum of money to get your data back. And about 300,000 healthcare data breaches happened in 2017. This cost the consumer billions of dollars across all industries. So one of the nice things about blockchain, it could mitigate the cybersecurity issue because of its complexity and its stability. The other nice thing is it's a peer-to-peer network, so there is interoperability. If you're on the network, then you can, because it's a public ledger, you can look at the information on it without ceding control, and this really would reinforce interoperability and patient-centeredness. And there's also transparency of information because all the data has to be, there's a consensus mechanism before adding data, and there's time stamping as well. Once again, the cryptographic features enhance user verification, access control, security, and privacy, and this makes the data more accurate. Some of the weaknesses of blockchain include its accessibility, who's going to be able to access the data, change management, obviously. We as providers in healthcare are somewhat reluctant to change quickly. Ownership of the blockchain as well as standardization would be other issues. Some of the opportunities, though, include revenue cycle management, elimination of middlemen or clearinghouses, be a great tool for physician credentialing. For example, at UNM, it takes about 6 months if you have a work record to get credentialed at UNM, and this is because of all of the steps they have to go through. If a physician just put all of their work history and other data on a blockchain, it would be right there instantly ready to use. And also supply chain management. Some of the threats, though, obviously if this was to be adopted, you'd have HIPAA and high-tech, and these questions have yet to be answered. If you look at the amount of electricity it takes to run one of these chains, one estimate was that Bitcoin network alone consumed the same amount of energy as countries like Ireland and Australia, so it's a ton of energy. It's not very green. And then once again, internal attacks would always be an issue, although with large blockchains, this is less of a threat. So in conclusion, blockchain is a newer technology that has privacy, security, and interoperability that currently EHRs could be better than our current EHRs. And this makes blockchain an advantageous system over traditional systems that we have today. Sorry, so now I'm going to talk about another technology, artificial intelligence in healthcare. If you look at artificial intelligence, the market is about is projected to be $188 billion by 2030. The compound annual growth right now is, if you look at 2022 alone, is 37% or $11 billion. And ChatGPT had about 100 million users within a week of its launch in November 2022, so pretty incredible. Delivery in healthcare lags behind other industries, and the reason for this is because the information in healthcare, it's just harder to train these algorithms because of the complexity of data. Putting AI into an already complex clinical workflow can be difficult, and most healthcare organizations are not focused on long-term financial things. Right now, most of them are focused on near-term financial results, especially after COVID, where margins for hospitals were zero, negative, or now just getting back to positive, maybe 1%. And really, AI in healthcare is an adjunct to the body of knowledge needed to treat a patient. If you look at information change over time, in 1980s, the information knowledge doubled about every 7 years. 2010, it was about 75 days. And now medical students graduating really don't have much knowledge at all. It will change probably before they graduate. So it's pretty incredible how quickly knowledge is changing. What is artificial intelligence? It's machine learning, learn from examples rather instead of predefined rules, and natural language processing, which transforms human language and unstructured text into machine-readable data. So it just reflects the intent of the language. If you look at some of the artificial intelligence platforms right now, they're actually running out of data to learn from. So that's another interesting problem. The cost is pretty incredible. It's about $700,000 a day to maintain one of these systems. So that's $250 to $300 million a year just in maintenance. A platform takes 30,000 NVIDIA graphic processing units to operate. These cost about $10,000 to $15,000 per unit, so that's about a $300 million bill for a platform. And that's why the costs require massive amounts of capital and computing power, and that's why these companies, Google, Amazon, Meta, Apple, are the ones who are developing this technology. And then the question becomes, in time, if you use AI to, say, for drug discovery or things like that, you know, who's going to own the rights, the intellectual rights to that? That'll be an interesting question in the future. So if you look at artificial intelligence role in healthcare, it's really improving clinical judgment. And some of the ways you can use this that's easily, you can easily train the machine is image analysis. So 30% of radiology practices have adopted AI, another 20% say they plan to use it, but other image analysis specialties include cardiology, radiology, pathology, dermatology. Potentially in urology, I could see this used for cystoscopic image analysis and other, you know, things we use in urology all the time. What about AI in healthcare? Where are some realistic ways it could be used right now? This paper was from the New England Journal of Medicine, July 2023. But some of the ways the AI can impact healthcare includes reimbursement, clinical operations, quality, and safety. And this is just from that paper. So if you look at reimbursement, AI has higher than average total mission value to an organization because you can use it for revenue cycle management. If you look at claims management, about 10% of claims are denied or delayed because of eligibility or missing data, and 85% of those that were denied could have been avoided. So you can use AI modeling to run data on claims denials and use a predictive model and find out which claims are denied and which claims aren't, and then rerun your claims data through this so that they will hopefully be accepted by the payer. So using AI, this impacts costs by decreasing the administrative burden on the organization. This decreases revenue cycle time, improves operating revenue, but it also improves patient satisfaction because patients then aren't stuck with a bill because the claim was actually submitted correctly. Other place AI can be used is clinical operations. It's not as advanced in clinical operations right now as it is in other things, but the reason for this is because it's more complex. There is an impact on risk, and a change can be difficult once again. An impactful way you could use it in clinical operations is the operating room. This is the most critical asset for a healthcare system. The demand is high. And the three steps in really optimizing operating room time is improving the management of the operating room, but also predicting use in operating room analytics. Quickly using it for operating room analytics, you can look at prediction analysis and analytics in real time. And this allows basically to reduce cancellations, estimate mortality. If you use analytics in real time, it gives you more precise scheduling, and you can integrate predictions such as cancellations into operating room optimization. And using these models, the Mayo Clinic was able to increase their utilization by about 19% and decrease their overtime costs by 10%. And the Children's Hospital at Stanford did the same thing. So it did help in terms of increasing the use of this scarce resource. In terms of quality and safety, it can be used for non-financial factors, for safety, patient experience. You can use it for adverse drug events, looking at decompensation and diagnostic errors. One way it was modeled was looking at sepsis. So a large healthcare organization used an AI algorithm to predict, which patients might be becoming septic, and then to intervene more quickly by alerting providers. And they used EHR data in combination with other vital sign monitoring. And what they found over 5 years is they estimated they saved about 8,000 lives because they were intervening more quickly. This was also used with clinical deterioration in the ICU, and they were able to reduce mortality in about 21 hospitals. Consumer experience also, you can look at how patients perceive their care, look at the negative aspects of care, run this through an AI algorithm to really focus on those and how you can improve their experience and better identify resolution of their issues. And this obviously impacts your hospital system by increasing its scoring on Medicare databases. So anyway, these are the different ways AI can be used in terms of quality and safety. But finally, AI, really it's a change management thing. I mean, we all have to adopt AI into clinical practice, and I think this will be a big hurdle to overcome. And this was from the Harvard Business Review and healthcare and AI, and you know how you've got to build trust in AI. So you have to build trust with all stakeholders, and the 3 things you need to have to build trust includes changing the narrative about the purpose, that it's not here to replace us all, but it's here to augment the expertise of providers. It's also, you have to pay careful attention to how the applications are implemented, and then assure the service needs of patients and the public are met without threatening their rights. So finally, I just briefly want to go through this on how non-healthcare companies are entering the healthcare industry. Why do this? It's basically economies of scale. Healthcare companies, if you look at a small hospital, their costs are going to be greater than one of these large companies. And so they can do this cheaper than you know, the individual hospital or even some hospital, multi-hospital organizations. So good examples, Amazon, they just bought One Medical for $3.2 billion. So they have physicians, they're masters of supply side, they have all the web-based services including cloud and AI, and they also have the logistics. They can get anything, anywhere, anytime, pretty quickly. So this is One Medical for $144 a year. You get all these services, which is pretty incredible. And they just hired a guy named Brad Smith, who's the former director of Humana. And according to MarketWatch, Amazon intends to exploit the healthcare opportunity through an emphasis on its acumen in technology, which is very pertinent right now. Walmart has Walmart clinics now, healthcare clinics. They are also very good at supply side and logistics. By the end of 2024, there will be about 75 Walmart health centers in the United States. So they're really getting into the space pretty quickly. Google has clinical partnerships. They once again have all the tech, and they also make wearable and other healthcare devices. These are all the partnerships Google currently is involved in. Apple, once again, tech, wearable devices. They're supposedly going to get into the health insurance business in 2024. And finally, Microsoft, who was one of the backers of OpenAI, creators of ChatGPT, but they also have AI and all these other services. And Azure actually is partnered with Epic, and they're putting AI into Epic's EHR to help providers with things like alerts and medical records, et cetera. So the old adage, no margin, no mission. Basically, the biggest thing that we've seen in the past few years is the cost of labor for healthcare, and it's really impacted the bottom line. And so these companies can do this a lot more cheaply because they can do it using economies of scale. And why get into it anyway? Well, if you look at the federal government and how much money they fund healthcare, it's $1.5 trillion. So obviously, if you can tap into some of this money, it's advantageous. And so for them, the mission is the margin. And obviously, they're out to make a profit. So is this the future of healthcare? Amazon, they're masters of logistics. They could probably get a patient to the hospital pretty quick, I'd imagine. And who knows? Walmart, you never know. This may be coming too. There may be the Walmart Department of Urology. So anyway, in conclusion, IT has slow evolution. It has been slow, but it is evolving in the healthcare industry. Interoperability, unfortunately, is still not available, and I think it's going to be a while before we actually see that. I think blockchain has a great potential in healthcare. AI will be used in healthcare more as a tool than a replacement, but it's not going to be cheap. It's going to increase the costs over years because these platforms take a lot of money to run. And finally, who knows what the healthcare future will hold, but there is a now a large landscape of corporations that are entering the healthcare space that are non-healthcare, have non-healthcare backgrounds. Anyway, and here are all my references. So, thank you.